Let us look at radiopharmaceuticals. So, radiopharmaceuticals are radioactive substances, often radioisotopes, that are used for diagnosis or treatment of diseases, including cancer. They can be administered to patients, allowing doctors to visualize and assess bodily functions, detect diseases, and also monitor treatment. Uses of radioisotopes in medicine. They have diagnostic applications. Here, they are used to image organs and detect diseases with high sensitivity. You can use iodine 123 for thyroid scans and technetium 99M for bone imaging. Then they have therapeutic applications. Here, they are used to deliver targeted radiation so that you're able to treat diseases, especially cancers. For example, you can use iodine 131 to manage thyroid cancer and hyperthyroidism. You can also use gold 198, iodine 131, and cobalt 60 as therapeutic aids for specific conditions. Isotopes are used during sterilization and preservation. For example, cobalt 60, which is a gamma emitting isotope, is used to sterilize pharmaceutical products. It has also been used experimentally, that is cobalt 60, for sterilization, and this includes sterilization of surgical gloves and sutures. Radioisotopes are also used in research and drug development, whereby they are used in tracing drug metabolism, distribution, and mechanism of action. So remember pharmacokinetics. Radioisotopes are used in quality control and instrument calibration. So they will be used to test instruments and also validate the methods that are used in pharmaceutical manufacturing. So they will check the position of scintillation counters or gamma cameras. And a scintillation counter is an instrument that is used to detect and measure ionizing radiation. They can also be used to calibrate radiation detection equipment. Last but not least, they are used for analytical purposes. For example, isotope dilution analysis. Radioisotopes as therapeutic and diagnostic aids. Factors to consider when selecting radioisotopes. Number one, you need to consider safety of use. Why? Because they can cause health hazards. So you should not be exposed to radiations unnecessarily. Number two, the type and kind of radiation emitted. Is it beta, gamma, or alpha? All these radiations have different properties. For example, for diagnostics, we prefer gamma emitters. Number three, half-life. The half-life should match the biological process and logistics of use. It should not be too long or too short. If it is too short, it will not be enough time for imaging or delivery. If it is too long, it can lead to unnecessary radiation exposure. Factors to consider are the chemical properties and compatibility. So when it comes to compatibility, we want the radioisotope not to interfere or to alter the normal cell physiology. And then you also want it to allow for stable labeling with biologically active molecules. Number five is distribution into the body's fluids and cells. And here you want it to move or to go to the targeted cells, okay? Because there can be destruction of cells if it stays longer in the body. And then the other factor is availability and production. It should be readily available and also economically feasible. I also need to consider the source. We look at some of the radioisotopes of importance in health sciences. Number one, we have iodine 131. Remember, radioisotopes are used as diagnostic aids and also therapeutic aids. So this iodine 131 has both diagnostic and treatment applications. The half-life is 8 days, which is ideal. It produces beta particles and penetrating gamma radiations. Remember, here we are looking at the penetrating properties of these radiations. And then the other advantage is that it can easily be incorporated into a carrier molecule, and it concentrates in thyroid tissue and malignant tumors. When it comes to its application, it can be used in hyperthyroidism management, thyroid cancer ablation, and also diagnostic imaging in low doses. The other radioisotope of interest is phosphorus 32. And this one tends to concentrate in rapidly dividing cells, and therefore it is important, whereby it can be used to locate brain tumors. So when it comes to their diagnostic application, it can be used to identify the presence and location of brain tumors. And then therapeutic application, it is used in treatment of chronic leukemia. What is the potential side effect? It can cause excessive bone marrow suppression. The other radioisotope is chromium-51. This one can be found in form of sodium chromate and also chromium-3 chloride. When chromium-3 chloride is administered intravenously, it can be taken up by plasma proteins, and this makes it useful as a reagent for volume determination. Then, when administered as chromium-4, it is taken up by plasma, and then it is rapidly reduced to chromium-3 that binds to erythrocytes. And once it is bound to the erythrocytes, it cannot leave the red blood cells. And this makes it possible to determine the circulating red blood cell volume and red blood cell survival time. So the determination of red blood cell volume and survival time is valuable when it comes to the diagnosis of hemolytic anemia. So you can simply say that chromium-51 is used to label red blood cells for determination of circulating red blood cells volume, RBC survival time, and plasma volume. Radioisotope of interest is cobalt-60. From the equation, we can see that it produces gamma rays, and remember, gamma radiation has very good penetrating power. So this radioisotope can be used in two forms: as a metal itself for therapeutic effects because of the gamma radiation, and then you can also use it as a radiocobalamin solution, which is very, very important, and it is used as a diagnostic agent in pernicious anemia. We have gold 198. So some of the patients in the last stages of malignancy tend to develop extensive fluid accumulation. And so when you use gold 198, it suppresses the mechanism of secretion. So gold 198 is useful in medicine, primarily used in brachytherapy for cancer treatment. And brachytherapy is simply placing radioactive material inside the body, and this is sometimes known as internal radiation. So this gold 198 emits beta and gamma radiation, which tends to destroy cancer cells while minimizing damage to surrounding healthy tissue. So gold 198 has been used to treat prostate cancer, liver cancer, and other localized tumors. And also intra-articular radioactive colloidal gold 198 has been used in the treatment of rheumatoid arthritis. The next one is radium 226. It was used historically for treating cancer through brachytherapy. We've already mentioned that brachytherapy is also known as internal radiation. It also produces radon gas, which can be inhaled for therapeutic purposes, but now it has also been shown to cause lung cancer. Now we have newer, safer, and effective alternatives that can be used. And we have a scientist called Marie Curie, who died because of working with radium, and the cause of death was aplastic anemia. Remember, Curie is one of the units that is used in measurement of radioactivity. Then we have radium-223 that is used to treat bone metastasis in prostate cancer. Radioisotope is technetium-99m. It is ideal for diagnostic imaging because of its favorable physical and chemical properties, and therefore it can be used in bone scans. And the radiopharmaceutical there is technetium-99m, MDP or HDP. MDP stands for methylene diphosphonate, HDP hydroxy diphosphonate. These are two different radio tracers that are used to visualize bones. Then we have thyroid imaging. The radiopharmaceutical there is technetium-99m pertechnetate, and it is used to evaluate thyroid nodules, hyperthyroidism, or ectopic thyroid tissue. Sample questions. What are radiopharmaceuticals? Briefly discuss the uses of radioisotopes in medicine. Briefly explain the factors to be considered when selecting radioisotopes to be used in medicine. List any 5 radioisotopes of importance in medicine. Discuss uses of any 5 radioisotopes of importance in health sciences. Thank you. Thank you.